Hold your hands out in front of you right now and look at them carefully. Look at your fingers, your nails, your skin, and the way your hands move. If you are over 60 and you see trembling, swollen knuckles, changes in your nail color, numbness in your fingertips, or skin that has become paper thin, doctors say your hands may be showing you early signs of serious diseases that are developing inside your body. And most seniors walk through their entire day using their hands without ever stopping to look at what those hands are trying to tell them. I am not exaggerating when I say that your hands are one of the most revealing parts of your body. They contain 27 bones, dozens of joints, an intricate network of blood vessels and nerves, and they are connected to virtually every major system in your body. When something goes wrong with your heart, your liver, your thyroid, your nervous system, or your immune system, your hands are often among the first places to show visible changes. And yet, because we use our hands constantly and see them every day, we tend to overlook even dramatic changes because they develop gradually. My name is Dr. Michael Williams, and what I'm about to share with you today is something I wish every senior knew. Your hands are a diagnostic roadmap. The changes happening in them right now could be revealing conditions that have not yet caused any other symptoms. Catching those conditions early before they progress can make an enormous difference in treatment options and outcomes. In this video, I'm going to walk you through 9 changes in your hands that doctors say are red flags for hidden diseases in seniors over 60. I am going to explain what each change means and which body system it is connected to. And I'm going to tell you which changes need immediate medical attention and which ones you should bring up at your next doctor visit. The 7th change is something that over half of seniors notice and completely ignore. But endocrinologists say it could be revealing a thyroid disorder that is silently affecting your heart, your weight, and your energy levels. So stay with me through this entire video because your hands have a lot to say. Let us begin with the first change, and it is one that many seniors notice but rarely connect to anything beyond normal aging. It is a fine tremor in your hands, especially when they are at rest. Now, there is an important distinction to make here. A slight tremor when you are holding something heavy, reaching for an object, or keeping your hand extended in the air is called an action tremor, and it is often related to a common and generally benign condition called essential tremor. Essential tremor tends to run in families and typically affects both hands symmetrically, but a tremor that appears when your hands are resting in your lap, when they are not doing anything at all, is a different matter entirely. A resting tremor, particularly one that affects one hand more than the other, is one of the earliest and most classic signs of Parkinson's disease. Parkinson's is a progressive neurological condition that affects the brain cells responsible for producing dopamine, and it can impact movement, balance, and coordination over time. If you have noticed a new tremor in your hands, pay attention to when it happens. Does it appear at rest? Does it affect one hand more than the other? Does it look like a pill rolling motion, where your thumb and index finger move together in a circular pattern? If so, this is a symptom that needs to be evaluated by a neurologist. Early diagnosis of Parkinson's allows for treatment that can significantly slow the progression and maintain quality of life for many years. But the tremor is just the beginning, because the second hand change reveals something happening in an entirely different part of your body. It is clubbing of the fingernails. Clubbing is a condition where the tips of your fingers become enlarged and rounded, and your nails curve downward around the fingertips, resembling the round end of a drumstick. This change usually develops gradually over weeks to months, and many people do not notice it until it is quite pronounced. There is a simple test you can do right now. Place the nails of your 2 index fingers together, back to back. In normal fingers, you should see a small diamond-shaped gap between the nail beds. If there is no gap, and the nails press flat against each other, this may indicate clubbing. Clubbing is significant because it is strongly associated with conditions that reduce oxygen levels in the blood. The most common causes in seniors include chronic lung diseases like COPD and pulmonary fibrosis, heart diseases that affect oxygenation, and in some cases, lung cancer. The mechanism behind clubbing is not fully understood, but it is believed to involve growth factors released in response to chronic low oxygen that cause the tissue at the fingertips to enlarge. If you notice that your fingertips appear more bulbous or rounded than they used to be, or if the diamond-shaped gap disappears when you place your nails together, this is a change that warrants medical evaluation, including tests of your blood oxygen levels and lung function. The third change is one that is visible on the surface of your nails. It is changes in nail color, texture, or markings. Your fingernails are like a health journal that records what has been happening in your body over the past several months. Because nails grow slowly, about 3 to 4 millimeters per month, changes in nail appearance can reveal problems that occurred weeks or months ago. Pale or white nails can indicate anemia, liver disease, or malnutrition. Yellow nails can be associated with fungal infections, lymphedema, or chronic respiratory conditions. A dark streak running lengthwise through a nail can sometimes be a sign of melanoma, the most dangerous form of skin cancer, and it should always be evaluated by a dermatologist. Horizontal dents or grooves across the nail, called Bowes lines, indicate a period when nail growth was disrupted, which can be caused by severe illness, surgery, chemotherapy, or uncontrolled diabetes. And tiny pits or dents in the nail surface can be associated with psoriasis, an autoimmune skin condition. Take a moment to look at your nails under good lighting. If you see any changes that are new, unexplained, or concerning, mention them to your doctor. Your nails might be revealing something important that the rest of your body has not shown yet. The fourth hand change is one that millions of seniors deal with daily and that most attribute entirely to arthritis. It is swollen, stiff, or deformed finger joints. While osteoarthritis is indeed the most common cause of joint swelling and stiffness in the hands after 60, it is not the only cause, and assuming that all joint changes are simple arthritis can lead to missed diagnoses. Rheumatoid arthritis, which is an autoimmune condition where the immune system attacks the joints, tends to affect the small joints of the hands symmetrically, causing swelling, pain, and warmth. Unlike osteoarthritis, which develops gradually from wear and tear, rheumatoid arthritis involves active inflammation that can cause joint destruction if not treated with appropriate immune-modulating medications. The pattern of joint involvement can help distinguish between the two. Osteoarthritis typically affects the joints closest to the fingertips and the base of the thumb. Rheumatoid arthritis more commonly affects the middle joints of the fingers and the knuckles. Gout, another form of inflammatory arthritis, can also affect the hands, causing sudden, severe swelling and pain in individual joints. And in rare cases, swollen hands can be an early sign of certain cancers or systemic diseases. If your hand joints are swollen, painful, warm to the touch, or increasingly stiff, a proper evaluation including blood tests and possibly imaging can determine exactly what type of arthritis you have and ensure you receive the most appropriate treatment. The fifth change involves something you can feel but might not be able to see. It is numbness, tingling, or a pins and needles sensation in your fingers. While carpal tunnel syndrome, which compresses the median nerve at the wrist, is a common cause of finger numbness, there are several other conditions that can produce similar symptoms in seniors, and that carry much more serious implications. Peripheral neuropathy, which is nerve damage in the hands and feet, is extremely common in seniors with diabetes, even in those with well-controlled blood sugar. The numbness typically starts in the fingertips and gradually works its way up. Vitamin B12 deficiency, which affects up to 40% of seniors, can also cause tingling and numbness in the hands. Cervical spine problems, where arthritis or disc degeneration in the neck compresses nerves that run down to the hands, can cause numbness, weakness, and pain that follows specific nerve pathways. And in some cases, numbness in the hands can be an early sign of multiple sclerosis, Guillain-Barré syndrome, or other neurological conditions. If you are experiencing persistent numbness or tingling in your hands, especially if it is new, progressive, or accompanied by weakness, please have it evaluated. Identifying the underlying cause is essential for preventing further nerve damage and preserving hand function. The sixth change is visible on the skin of your hands, and it can reveal problems with your blood and circulatory system. It is color changes in your fingers. If your fingers turn white, blue, or red in response to cold temperatures or stress, you may have a condition called Raynaud's phenomenon. In Raynaud's, the small blood vessels in the fingers go into spasm, temporarily cutting off blood flow. The fingers turn white as blood flow stops, then blue as the remaining blood loses oxygen, and finally red as blood flow returns. While Raynaud's can occur on its own in seniors, it is sometimes associated with underlying autoimmune diseases like scleroderma, lupus, or rheumatoid arthritis. It can also be caused by medications, including certain blood pressure drugs and migraine medications, or by conditions that affect the blood vessels like atherosclerosis. If your fingers frequently change color in response to cold or stress, a medical evaluation can determine whether it is isolated Raynaud's or a sign of a broader condition that needs treatment. The seventh change is the one I mentioned at the beginning, and it is something that more than half of seniors notice without realizing its significance. It is dry, thin, or parchment-like skin on the backs of your hands. Now, some degree of skin thinning is normal with age as the skin produces less collagen and loses subcutaneous fat over time. But when the skin on the backs of your hands becomes extremely thin, dry, and fragile, to the point where it tears easily or bruises from minimal contact, it can be revealing more than just aging. Extremely dry, thin skin on the hands can be a sign of hypothyroidism, a condition where the thyroid gland does not produce enough hormones. The thyroid controls your metabolism, and when it is underactive, your skin loses moisture, becomes dry and rough, and thins more rapidly. Hypothyroidism also causes fatigue, weight gain, sensitivity to cold, brain fog, and depression, and it is remarkably common in seniors over 60, particularly in women. Many people attribute these symptoms to normal aging and never get their thyroid checked. Thin, fragile skin can also result from long-term use of corticosteroid medications, from nutritional deficiencies, or from vascular insufficiency where reduced blood flow to the hands impairs the skin's ability to maintain itself. If the skin on your hands has become noticeably thinner, drier, or more fragile than it used to be, a simple blood test to check your thyroid function, along with tests for nutritional deficiencies, could reveal a treatable cause. The eighth change involves the strength and coordination of your hands. It is a noticeable decline in grip strength or difficulty performing fine motor tasks. If you have been struggling to open jars, button shirts, use a key, or grip objects as firmly as you used to, this could be more than just arthritis or general weakness. Research has shown that grip strength is one of the most reliable predictors of overall health, cardiovascular risk, and longevity in seniors. Studies have found that weak grip strength is associated with a higher risk of heart attack, stroke, hospitalization, and mortality. Declining grip strength can indicate sarcopenia, the age-related loss of muscle mass that accelerates after 60. It can be a sign of nerve compression in the neck or arm. It can result from nutritional deficiencies, particularly in protein and vitamin D. And in some cases, it is an early indicator of neurodegenerative conditions. If you have noticed a significant decline in your hand strength, mention it to your doctor. A simple grip strength test can be performed in the office, and the results can guide further evaluation and treatment. The ninth and final change is one that appears suddenly and should always be taken seriously. It is the sudden onset of hand swelling, particularly if only one hand is affected. While bilateral hand swelling can be caused by conditions like heart failure, kidney disease, or medication side effects, sudden swelling in one hand can indicate an infection, a blood clot, or a blockage in the lymphatic system. In rare cases, unexplained swelling in one hand can be associated with certain types of cancer that affect the lymph nodes. If one hand becomes suddenly swollen, especially if the swelling is accompanied by redness, warmth, pain, or fever, seek medical attention promptly. These symptoms could indicate a condition that requires urgent treatment. Let me recap the 9 hand changes we covered. First, a resting tremor that could indicate Parkinson's disease. Second, clubbing of the fingernails suggesting low oxygen conditions. Third, changes in nail color, texture, or markings revealing various internal conditions. Fourth, swollen or deformed finger joints that may not be simple arthritis. Fifth, numbness or tingling from nerve damage, vitamin deficiency, or spinal problems. Sixth, color changes in the fingers suggesting Raynaud's or vascular issues. Seventh, extremely thin, dry skin that could indicate thyroid problems. Eighth, declining grip strength that predicts overall health risk. And ninth, sudden one-sided hand swelling requiring urgent evaluation. Your hands tell a remarkable story about your health. They are with you every moment of every day, and they are constantly showing you clues about what is happening inside your body. Please take a few minutes to really look at them. What you see might be the most important health information you receive this year. If this video was an eye-opener for you, please subscribe to this channel. I share new content every week designed to help seniors recognize the signs their body is sending and take action before small problems become big ones. And if you know someone over 60 who might benefit from looking a little more closely at their hands, please share this video with them. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of those hands and take care of yourselves.